Hi, this is Dr. Lenore Ackerman from Cedars-Sinai Medical Center. We are here today with Dr. Nicole Gilbert, who's an instructor at Washington University School of Medicine in St. Louis, who is a magnificent researcher looking at the interplay between the vaginal and urinary microbiota and how this impacts lower urinary tract health and infections. And I'm very pleased to introduce you. Can you tell us a little bit about what you've been working on?
Yes, I'd be happy to. Thank you for that introduction and for inviting me to share my research with you. I thought it would be good for me to first introduce some of the evidence for the idea that there is an interplay between the urinary and vaginal microbiota. So it's long been believed that transfer of bacteria from the vagina to the urinary tract has been regarded to occur, and it's been regarded as a source for urinary tract infection and recurrent UTI. We know that sexual intercourse is a leading UTI risk factor, and it is believed that that is to facilitate these transfers. Now, historically, the bladder has been regarded as sterile in the absence of an overt infection. However, more recently, there's been a boom of studies suggesting that bacteria are present in the bladder. These are being referred to as the urinary microbiome, whereby live bacteria are detectable in urine that's collected directly from the bladder, either by transurethral catheterization or by suprapubic aspiration. And two genera that are frequently detected at high abundance in these studies are Lactobacillus and Gardnerella. And it turns out that these two organisms are actually associated with the vaginal microbiota, with Lactobacillus being associated with health and Gardnerella being found as one of the most abundant organisms in vaginosis, which is a dysbiosis of the vaginal microbiota that's experienced by up to 1/3 of women in the United States. Now, these parallel findings of these organisms between the urinary and vaginal microbiota suggested that there is a connection between these two niches. And some more recent data shows a substantial overlap in the microbiome composition of paired vaginal and urine specimens. You can see here in the middle. These are specimens from the same woman at the same time point, either in the vagina or the bladder. And we've been really interested in understanding how these urogenital microbes might be affecting the bladder. And we've been developing models in mice to look at this. We first looked at Gardnerella vaginalis, because it's been associated with lower urinary tract symptoms, because it's present vaginally in bacterial vaginosis, which itself is associated with UTI. Now, to show the effects of Gardnerella, I'm first going to show you some SEM images, some scanning electron microscopy images. And what you're seeing here is this is a healthy bladder, and it's looking down at the surface of the urothelium, showing the large superficial umbrella cells. This mouse was inoculated with phosphate buffer saline just as a control, and you can see that the epithelium is nice and intact. Now next, here is an image of a bladder from a mouse that was inoculated with Gardnerella vaginalis. And you can see that many of the superficial cells have exfoliated away, revealing the underlying transitional epithelium. And we think that there are a lot of ways that this type of exfoliation could be affecting lower urinary tract health. But one of the first things that we focused on is its impact potentially on E. coli recurrent urinary tract infection. And this was because some previous studies, especially in mice, had linked exfoliation with UTI. These previous models in mice showed that E. coli, which, as you know, is one of the most common causes of UTI, can establish latent intracellular reservoirs inside the bladder epithelium. And these are present in the absence of any E. coli bacteria. They're resistant to antibiotic treatment. They're stable for many days to weeks. And there's some evidence that intracellular bacteria can be detected in women with recurrent urinary tract infections. So these reservoirs have been long regarded as a potential source for recurrent urinary tract infections. And some studies in mice showed that if you induce exfoliation of the urothelium, either by protamine sulfate or catechin, this can cause the E. coli reservoirs to wake back up and emerge back out into urine to cause a recurrent UTI. And so we wondered, since we had seen that Gardnerella could trigger exfoliation in mice, would it also be able to trigger a recurrent UTI? So we used this model that was previously generated in mice to generate these reservoirs in mice and look at whether, if we gave the mouse an inoculation with Gardnerella vaginalis, would this cause E. coli to emerge back out into urine? And what we found was that indeed, nearly half of the mice that were exposed to Gardnerella vaginalis had a recurrent urinary tract infection, shown here in this green bar. And importantly, we didn't see this in mice that we gave an inoculation of Lactobacillus crispatus, which is associated with health. Now, the E. coli that we detected was often at high titers and was associated with a neutrophil. So this did really look like an rUTI. And this rUTI was detected anywhere from 24 to 72 hours after the Gardnerella vaginalis inoculation. However, what was really fascinating was that the Gardnerella vaginalis bacteria itself was actually cleared from the bladder by 12 hours post-inoculation. So the E. coli rUTI was actually occurring after Gardnerella was no longer detectable in the urine. And so based on these observations, we propose that Gardnerella could actually be acting as what we've called a covert pathogen in the urinary tract. So we're used to thinking about UTIs in the context of recognized uropathogens, and they're detectable and abundant at the time of symptoms. And it's also been, widely recognized the existence of quiescent latent infections. But we think that a covert pathogen like Gardnerella vaginalis is one that only requires a transient exposure, and it's undetectable by the time the diagnosis occurs. And we think that this observation has some potentially important implications for how we think about the impact of bacteria on the urinary tract. We think that it suggests that microbial exposures might not necessarily need to be long-lived or stable in order for them to have an impact on the urinary tract. And those microbial culprits that might be important in disease might not be detectable at the time of symptoms. And before we spend any more time discussing some of these implications, I do want to make sure that I acknowledge everyone that worked with me on these projects, especially my mentor and collaborator, Amanda Lewis, and the graduate student, Valerie O'Brien, who was my partner on all of those mouse studies, and the WashU Center for Cellular Imagery for their help with the SEM analysis. But I can take us back to this implications and perspective slide so that we can spend a bit more time discussing that.
That's wonderful. So I wanted to ask a couple questions about what this might tell us about how we could treat your current UTIs sort of in the clinical setting. Are there ways to interfere with the with this effect of these sort of covert pathogens to prevent recurrent urinary tract infections if those are really the first step in the reactivation of recurrent UTIs?
Sure, that's a great question, and something I've spent a lot of time thinking about as well, because the fact that it doesn't require these sort of long-term, if it doesn't require long-term infection to take place, that it does provide a lot of challenges for how you would screen women to know if they're at risk. And I think one thing that this points to is that, like, for example, Gardnerella vaginalis, we might expect that while it's not maybe present in the bladder for very long term, we would expect that women who have Gardnerella vaginalis, colonization of the vagina, would be the ones most likely to experience these routine and frequent exposures. And so I know a lot of studies have already looked at the vaginal microbiome as it relates to UTI risk. And there's been a key study looking at whether vaginal lactobacillus probiotics would be helpful. And I think more studies in those directions are really, really needed to look at whether monitoring the vaginal or modifying the vaginal microbiota could be a helpful thing. I'm really excited about the most recent vaginal microbiome transplant studies. I think some more studies in that direction.
Yeah, I mean, it's very interesting because it seems like, what we do for recurrent urinary tract infections is continue to hit them with antibiotics. And when we then, if we can't get it under control with intermittent antibiotics, we go to suppressive long-term antibiotics. And a lot of those have been associated with the overgrowth of some of these bacteria that you've kind of implicated as being part of that process of recurrence. And so it
Right.
seems like instead of, this idea of instead of just suppressing the actual infection, of being able to modify those risk factors by modifying the microbiome, is a really interesting new perspective on how to approach some of these patients who can be quite refractory to treatment. Do you think Gardnerella is the only one that is capable of doing something like this, or are there sort of classes of bacteria that are kind of good colonizers versus bad colonizers? I know that's a very simplistic a perspective, but what do you think?
Sure. I think that it's likely that Gardnerella isn't the only organism able to do something like this. We don't really know anything as far as what about Gardnerella is specifically triggering an exfoliation, but we know that exfoliation is triggered by E. coli just during a UTI. So I do think it's a host response potentially to certain microbes in the bladder. And I think some of these other BV-associated bacteria are likely to cause similar or could be causing similar effects. I think it's also important to keep in mind that different strains of lactobacillus are associated with either health, like lactobacillus crispatus is the widely considered as the most healthy vaginal microbiome or microbiota component. However, some other strains of lactobacillus are quite different, and I think that there's even potential for certain lactobacillus species to be having some negative effects on the bladder. So I think that's really important to keep in mind when thinking about modifying the microbiota, that the specifics of it matters.
Yeah, so we've seen a bunch of new evidence coming out that there are significant differences in Gardnerella strains and differences in lactobacillus strains, and so there may be obviously some strain effects that impact. Do you have any thoughts about? So I think there's, feel free to not know this one, but when we talk about bacterial vaginosis, I think there's still quite a lot of disagreement about what that term really means. We have patients that are clearly symptomatic, who've got discharge and discomfort, and they tend to have, things like Gardnerella around, but there's plenty of women who are colonized with Gardnerella who don't seem to manifest with the same symptoms, yet have a very bacterial vaginosis-like microbiota. Do you have thoughts on, are there differences between those two conditions, the symptomatic and the not symptomatic, or is it just that we're missing some part of this that is actually more related to the whole environment between women with the Lactobacillus crispatus versus a Gardnerella kind of focused microbiota?
Sure. So I think those are really good points, and it's really you're bringing up the notion or the fact that just being able to define BV is quite challenging. We always find ourselves dancing when we're writing sort of the intros to our papers of what we call, whether we're calling BV or whether it's the CST4 vaginal microbiome, and clearly there are differences between the different Gardnerella strains. And as far as whether a woman that has a Gardnerella dominant or a polymicrobial vaginal microbiome but doesn't have symptoms, whether she's still at risk for other things, I think is still an open question, especially in the context of this whole recurrent UTI thing. I think there's a possibility that some women might have abundant Gardnerella and it doesn't cause any problems because they might have a particular Gardnerella strain that isn't causing a lot of these features. But there could be a woman who has abundant Gardnerella in the vagina and there's no symptoms there, but she could still be at risk of UTI because the Gardnerella is still capable of causing those effects in the bladder, and we really have no idea if that's the case. So again, specificity and understanding more of the particular strain differences is key, I think.
That's wonderful. Thank you so much for all this great information. I think this is really, really impactful work, and I think it's definitely influenced how I look at the treatment of recurrent UTI in the clinic, and I hope it does for other people as well. Thank you so much for your time and for all this wonderful research.
Thank you for having me. It was a pleasure.